And at that point of time, right, my mother did not know much about the condition, neither did I. And she told me,
don't tell anyone because then you'd not get a husband.
Hi, my name is V and I'm 25 years old.
My name is Dina Marzuki. I'm 33 years old. I am an event director, transformational coach, and president and co-founder of my PCOS I Love You.
My name is Dr. Sujitra. I've got a special interest in women's health. I've been practicing as a general practitioner for almost about 6 years plus now.
I was diagnosed with PCOS since I was 16 years old.
I myself have suffered with PCOS for 17 years.
So PCOS, known as Polycystic Ovarian Syndrome, it's basically a hormonal imbalance, meaning there is an excess in male hormone, which is known as androgen. So when this particular male hormone is excessively produced in the body, that causes a lot of cysts in the ovaries. The particular ovary enlarges because of multiple cysts or follicles in it. That makes it, that particular ovary, to be unable to produce eggs or ovulate every month.
I still remember the day I was diagnosed with PCOS very clearly. My doctor told me that I have PCOS. He didn't really explain much about the condition, but he said things like, you won't be able to have children in the future, you're going to have acne, you're going to gain weight, but you haven't yet. So it really scared me. And I was a typical naive girl who thought that my sole purpose in life was to get married and have many children.
I was 17 years old, I think, when I first was properly diagnosed with PCOS. I've always wanted kids on my own since a very young age. So to be told that you'll be infertile at 17 was very heart-wrenching for me.
So there's basically a stigma there. When a person has PCOS, they are branded for being infertile.
Like if you research PCOS, the last thing you'll see is, if not treated, leads to infertility. And that's like the biggest thing people look at.
And at that point of time, right, my mother did not know much about the condition, neither did I. And she told me,
don't tell anyone because then you'd not get a husband.
Although there is no ultimate cure for this, women with PCOS can get pregnant.
I've finally reached my goal, which is I just had a daughter that came 22 days ago.
It's just that they'll need a little bit more of a regular follow-up and close monitoring.
A lot more light needs to be shed on it, simply because the last research that was done on PCOS in Malaysia was in 2012.
When I actually talked about it with my friends, I found out that so many people have PCOS. It's actually so common. People just don't talk enough about it.
PCOS now, I would say it's a gynecological epidemic where I would say 1 in 10 women, they're diagnosed with PCOS. Because of this lack of awareness, PCOS, it definitely imposes certain risks, sometimes life-threatening risk as well. The main culprit in PCOS is something called as insulin resistance. Women are at higher risk to develop things like type 2 diabetes mellitus, cardiovascular disease, stroke, issues with mental health as well.
PCOS is essentially an invisible battle that a lot of women fight with every day. The symptoms that women with PCOS have don't usually get to be physically seen. So if you see a woman at work, you don't really know they have PCOS, but what they're suffering with are symptoms like headaches, migraines, bloating, joint pains.
You also have fatigue, so you'll be like, why am I so tired all the time? You have acne. I remember having acne in high school, and of course, your esteem drops, right? And you have weight gain. When I was first diagnosed, my doctor told me that if I do not take care of my lifestyle and my diet, I will be like the fat bearded lady you see in the circus. And he looked at me, you said, oh, but you're 41 kilos now. I think it's good, you just maintain this weight. So ever since I was 16, I have maintained this weight. I get panicky when I gain weight. So these few things actually affect your mental health more than anything else.
For the first 10 years, I think, I lived with the pain alone. And it also affected my mental state. And when I meant alone, it's because when I told my family about the pains I went through, everyone thought I was just being dramatic. For a long time, I thought it was all in my head. I also went to multiple doctors, and they too told me it was nothing. No, it's just your hormones, you're just acting out, it will get better, but it never did. Until I married my husband, so that's about 3 years ago. He actually inspired me to take it easy. How that worked was really a lot of lifestyle changes.
I do not order any drinks at any restaurants. I do not accept any snacks or whatnot.
And a lot of discipline and a lot of demotivated days that I hated. But it was all done gradually without trying to stress myself out every day. The biggest mistake I did was that I did everything so intensively, not realizing When I did cut out carbs, I cut out sugar, I worked out twice a day, I did not realize that all of that actually impacted my PCOS even worse, because then my stress hormones gets activated, which throws off my entire hormones again.
I think having PCOS is something that I've come to terms with. It's something that you live with. You can't help but to be reminded of it all the time. Like whenever I reject an ice cream, you immediately know, I have insulin resistance, I can't have too much sugar. I have to exercise. It has made me make more healthy choices consciously.
There has been a bit of awareness about PCOS, which is a good thing. But of course, we can definitely do better. I would say like 50% of the population don't have enough of awareness when it comes to PCOS.
If you suspect that you might have PCOS, it's usually because of missing periods. Especially if it's more than 2 months, I would say, just go to the doctor straight to get your test done. Some people living with PCOS, they don't know, and then they continue lifestyle habits that could actually worsen it. So if you have missed periods, don't just dismiss it as perhaps it's stress or whatnot. Get a check.
We always advise for annual screenings, at least yearly once if it's possible, but otherwise 2 years once to just get at least things like ultrasound scan, blood tests.
Tests can be expensive, but I tell you, it will be worth your time to know exactly where your health is at.
It's always good to monitor your menstrual cycle and make sure you watch on your lifestyle. If you have any kind of changes in your body, for example, excessive hair growth, acne eruptions, hair loss and all these things can be treated. Even if you're diagnosed with PCOS, it is not the end of the world. There is definitely treatment for it.
Know that you're not alone. There are a lot of communities to join around the world. In Malaysia, you can join our community. You can always reach out to us at mypcos I love you on Instagram to get recommended doctors, to get recommended supplements, or if you just want to talk and share, we're always there for you. Other than that, I think women with PCOS are always resilient, because every day we feel pain, we're always up and running the next day.
Thank you for watching this video. If you like this video, don't forget to like, share and subscribe to Measurable Southeast Asia, and stay tuned for more videos like these.